Yep.
So checking for quadratus lumborum, if there's any tightness in quadratus lumborum, it could present as a high ilium. So we want to check if there's any movement in that superior plane or our coronal plane type movement. Anterior and posterior rotation, we've looked at sagittal plane, but this one's more of a coronal plane movement. So if there's one QL that is excessively tight, you can actually pull that ilium right up, and we'll see that one side sits up higher than the other. So for our bony landmark locations, if we come in at the 12th rib, or just under the ribs there, with my fingers and my thumbs at the back. So I'm going to get those level at around that sort of T12 area. And my hands are just nice and relaxed here, and I'm looking for my straight line with my fingers. So my thumbs that are doing, they're creating that straight line there. The fingers aren't doing anything. So what I do is I come up and down, moving up and down, and I'm coming down until I hit the top of the iliac crest. Now I'm going to come down at eye level again, and my thumbs hit the top of the iliac crest, and you need to push in fairly firm for that as well. And we can see with Hannah here that my right side is sitting up just a little bit higher than the left. So that is a right high ilium. If it was, if there wasn't any height difference in there, they'd be sitting down nice and even, or if it was the left side, we'd be sitting up like that. But Hannah's is actually high on the right side there. Now that can also be not only from a tight QL, but it can be from a leg length discrepancy. If one leg is longer than the other, that's naturally going to lift that side up higher. The QL will still be in a shortened position, so it still would be indicated for treatment, but we're not going to be able to change that. And there is a correction for the high ilium as well that we can do. So that is the high ilium checks.